Okay, and in terms of kind of nutrients, really core nutrients that you're looking for when it comes to the health of the teeth, what are
Yeah.
your key go-tos there?
It's kind of like the basics for optimal health. It's vitamin D3 and vitamin K2 because they are very important for your bone and tooth mineralization, as well as various other things related to your immune system, hormone system, etc. Then omega-3 fatty acids, specifically triglyceride based, really from animal, not concentrate. Then the critical minerals will be magnesium and zinc, because if if you test patients in their red blood cell, they're mostly depleted in these because you need a lot of them in that stressful world. And a lot of these foods deplete you of it. For example, grains, chelate minerals, and vitamin C. Those are the absolute basics when it comes to micronutrients. So let's say the daily basics.
Yeah.
And then if your nutrition is on point, the number one macronutrient deficiency is protein and therefore amino acids. So I would always have in my bone healing protocol, there's always essential amino acids, plus even more amino acids, as well as some collagen and various different proteins to help you get to the daily protein requirement that I think is ideal. And this should be, in my opinion, it's about 2 grams per kilogram of lean body mass or your ideal body weight. So for male, it's probably I'm 84 kilograms and quite lean, let's say 10%. So my ideal is about 150 grams of protein a day,
Okay.
roundabout. So that's how I calculate it. And these powders will help. And then healthy fats and carbs is just depending what type of diet you would prefer. So if you, let's say you're a patient and you're more like a carnivore, highly parasympathetic person, probably who has a better digestion for heavy digestible foods, because red meat, eggs, butter, all is very, very hard to digest. And on the other end, we have more the vegans or let's say vegetarians or more the Mediterranean food, which is more monounsaturated fats and leaner proteins, more sympathetic persons that need more plants. That's just a simplification. I would also look at your HRV, heart rate variability, and your body type. So I'm a typical mesomorph person. My average HRV at night is about 60 to 80. So I'm a balanced body type, but I need a bit more carbohydrates, and I'm not as good with the carnivore. I can do carnivore, but I need carbs.
Yeah.
I'm an athlete. I just need fuel,
Sure.
and it doesn't work so good with fats. They just don't burn as quick. Let's say compare yourself with. I would be the sports car needing 25 liters on 100 kilometers. Some people are more the truck. They need six liters diesel, and they can just eat once a day and eat a huge meal, and they're super satiated because their body's just assimilating everything. That's not working for everybody out there. I'm also just timing all these different nutritional approaches individually. So,
Yeah.
for example, almost all my patients won't fast after the surgery, even though they're a big fan of intermittent fasting because it's a trend. No, because I want to have you be anabolic and not in a separate stressor. Because people mostly feel very good. Because first of all, when you fast, you skip a lot of these bad foods that I just mentioned, the core four. You also reduce calories most likely because you don't know about the timing feeding window and just reduce overall calories. But you're putting a toll on your adrenal glands and you're already chronically stressed because of your oral problems. You don't want to add more adrenal fire, cortisol, adrenaline. Even though it feels good to run on cortisol, adrenaline, I'm a junkie too, or have been. So I know how that feels, but it's not the best for your overall system.